which is the heart muscle, the pericardium, which is the membrane around the heart, and the endocardium, the lining of the heart. All those areas of the heart can be affected. And this is not noted oftentimes at the time of the acute infection. So kids can become ill, recover from the illness, and then 2 to 6 weeks after the infection, develop this inflammatory condition that could result in heart dysfunction, and also can result in heart arrhythmias and actually sudden death in those individuals. Fortunately, we don't see very much of this, but when we see it, it's it's horrifying, and it actually makes a case for vaccinating kids. Somebody had asked a question whether we've had any pediatric COVID deaths in Lancaster County. We've had a teenager die that I'm aware of that had with cerebral palsy and severe illness about a year ago. I'm not sure if there are any COVID deaths in children from Lancaster County, because quite frankly, if they become sick, we don't have a pediatric intensive care facility within the county. They'll go to Children's Hospital Philadelphia, or they'll go to Hershey. So I'm not sure whether or not that would occur. In addition to these direct deaths associated with the COVID virus, there are also other increases in deaths that are reported to our office, and we investigate, that I think occur as a result of the virus, either directly or indirectly. There have been an increase in number of suicides. Well, not usually in individuals who have gotten infection or family members, but the result of a lot of the isolation related to the pandemic. People were at home. People may have lost their job or may not be working for periods of time, and become very depressed and despondent because of the social isolation. And many of those individuals may take their lives because of this despondency. So we've seen in the county an increase in the number of suicides as a result of that. The other thing we've seen as well is an increase in the number of drug deaths. Now, it's interesting. The drug deaths have been largely overshadowed by the huge number of COVID deaths. So people don't talk about that as often. But about 4 years ago in Lancaster County, we had a record number of drug deaths. We had 168 deaths. And just to contrast this, when I first took office 13 years ago, we'd have 20 deaths, 25 deaths in the county per year as a result of drug overdoses. 4 years ago, it increased to 168. And I believe there's a chance that this year we may surpass that. Now, it's interesting, the type of drug that results in death has changed. It used to be predominantly heroin or opioids. Now, most of the people are dying as a result of fentanyl or methamphetamine. So the drugs are different causing the deaths, but they're deaths nonetheless. Sometimes people know they're getting fentanyl on the street. Sometimes people think they're getting heroin and they get fentanyl. I think, the drug trade on the street isn't exactly regulated by the FDA. So people don't have any idea what they're getting, and oftentimes will die as a result of a drug that they did not believe they were purchasing. As an aside, and this isn't talked about very much, but when people were getting unemployment at home and we saw a number of people actually, because they were getting sufficient funds from the government and were at home and weren't working, they had the means and the time to take more drugs. And we actually saw an increase in the number of drug deaths from that as well. So in summary, COVID is still here. And I believe COVID is going to remain a problem into the foreseeable future. Certainly the variants that are developing, pose challenges in terms of vaccination, and the resistance so much of the public has to the vaccination also is increasing everybody's risk of the virus. And certainly, people who are vaccinated, it doesn't mean that they're not going to get the disease. I mean, certainly, I can use myself as an example. I was vaccinated last December and January. In March, I ended up catching COVID of all people from my kids, not from patient, but from my kids. But, I wasn't that sick. And that's usually the experience of people who have been vaccinated. They may become ill, but not as ill as somebody who didn't get vaccinated. And again, the likelihood of ending up in the unit, in the ICU, on a ventilator with severe lung and heart disease is going to be far, far, far less in people who have been vaccinated versus people who have not been vaccinated. Let me try to address some of the questions that have come up during the talk. One question was, once an individual passes away, what's the risk of someone catching the virus from the body? To our knowledge, the risk is very low, because the mode of transmission for the virus is usually respiratory droplets. Now, having said that, whenever we remove an individual, if we need to take them to our facility to do further investigation, we always use all the personal protective equipment necessary to protect ourselves. So we have full masks, we have gowns, we use gloves, and I think anybody else taking care of individuals, needs to do the same thing. Interestingly, I had a talk about a month ago to the funeral directors at one of their monthly meetings, and that was a question they brought up as well. And they're trying to decide whether they should put a bag over the head of individuals they're removing. Again, the likelihood of transmission is very small, and I think there are really no clearly documented cases of transmission in that manner. Actually, are there any other questions? Or let me see. Do you have any variations in death from COVID, Delta, and Omicron? We have not personally seen that, but we don't test individuals we get called to determine which one of the variants they may have. From everything I've read, there isn't any clear-cut evidence, for example, that the Omicron variant causes worse disease. I think the Omicron variant is, however, more transmissible than either the Delta or the original COVID virus that was described. So I think that puts people at much greater risk, because people are more likely to come down with the virus. Whether it's more virulent and causes worse disease, I think is something that we have to see. If so much of this is so new and not studied, we don't always know all the answers to these things. Does anyone else have questions that I can answer for them? Or a question about any area I didn't cover?
Any questions, feel free to put them in the chat. We'll give it a minute or two, and then we'll wrap it up here.
Yeah. Question was, is it accurate to paraphrase in summary, older, unhealthy people were the majority of deaths, and deaths from younger individual are a rarity? I think generally speaking, certainly older, unhealthy people are at significantly higher risk. Younger individuals are going to be less likely to die or die as a result of the illness or become very ill. But I wouldn't say it's a rarity. We still see it. And I guess it depends on how you define healthy. If you look at individuals with BMIs over 30, which unfortunately makes up a pretty large percentage of the population, those individuals are also at significant risk. Obesity is really probably something that is underemphasized as a major, major contributor to people becoming extremely ill as a result of the disease.
So if you got a few more there.
Okay. Feel that deaths resulting from COVID complications months later are reported as COVID. I don't know the answer to that. I guess the reality is they should be, and it should come to our office, but not everyone is well educated in that. The interesting thing in terms of determination of cause and manner of death is that we always look at the proximate causes of death as being the manner, and the cause and the manner. So, if someone dies as a result of kidney failure from COVID, but the injury initially occurred as a result of the COVID infection. They in fact should be reported as a COVID death. Is COVID overdiagnosed as a cause of death? That's an excellent question, because that's a question that a lot of people have. And I'll tell you how we make that determination. You know, there's a untrue belief out there that if somebody has COVID and they happen to die, it's automatically labeled as a COVID death, regardless of whether COVID actually caused the death. For us to determine and classify it as a COVID death, we ask ourselves this question: if not for the COVID, would that person still be alive? And if not for the COVID, they'd still be alive, and they became ill from the COVID, that's listed as a COVID death. In other words, if they develop a pneumonitis, pneumonia, but they also have congestive heart failure and emphysema and kidney disease, and they may not have long to live anyway, if they would still have been alive, if not for the COVID, that's listed as a COVID death. And that's not different from anything else that we do. For example, if somebody's in a car accident and they had 2 months to live from cancer, but the car accident resulted in their having multiple traumatic injuries, we don't say they died from cancer. They died as a result of the accident, even though they may have had only a couple more months to live. Same thing is the case for COVID. There are no deaths that we report as being COVID deaths in individuals that would still be, that would have died from something else other than COVID within the time frame of the death. Someone asked what year I graduated from Lehigh. 1980, undergrad.
I think you touched on Ashley Stollenecker.
Yes, the argument.
You touched on that, yeah.
Yeah. Even so if someone's in an automobile accident, for example, and they had COVID, but they die as a result of traumatic injury from the automobile accident, the fact that they had COVID doesn't make a difference in our determination of cause and matter. And just as an additional illustration, if somebody is, and this has nothing to do with COVID, but just to illustrate this point, if someone is shot, for example, in an argument, and as a result of the bullet injury becomes a paraplegic, and they live another 40 years as a paraplegic, but they have to have a catheter in their bladder to drain the urine because they're unable to void on their own. If even after 40 years, they develop a urinary tract infection, and they die as a result of sepsis in their system from the urinary tract infection, that would come to our attention. We would classify that as a homicide and not a natural death. And the reason that's the case is if not for the gunshot wound 40 years ago, they wouldn't have the catheter in place. And if not for the catheter, they wouldn't have developed the infection. If not for the infection, they wouldn't have died. So the proximate cause was the gunshot wound. And the same thing is the case for COVID. If somebody dies as a result of complications of COVID, I would look at that as a COVID death. Now, honestly, I think a lot of those have not necessarily been reported to us, but they should be, and they should be included in part of the numbers.
All right, give it a last chance for questions, and then we'll wrap it up here. We're coming close to 1 o'clock. All right, let's wrap it up here. First of all, I want to thank Dr. Diamantoni. That was fantastic. Thank you so much for doing that. We really appreciate it here.
Thanks for having me.
Oh, absolutely. Again, I want to thank everyone who donated to see this talk. We here at the Lancaster Medical Heritage Museum are reliant on donations, and it is fantastic to see everyone who has supported us so far with this new venture of ours. These lunch and learns. Our next one is going to be on January 3rd, and it's going to be presented by Dr. Louise Stevenson. She's a professor at Franklin and Marshall College, and she's going to be talking on medicine and World War I. If you would like to see a complete list of everything, you can go to lancastermedicalheritagemuseum.org/events, and they're all posted there. You can register for anything you like. Again, thank you, Dr. Diamantoni, and thank you everyone for your time, and have a great rest of your day.
Thank you.